Hello. In this session, I want to step us through how to identify and then how to manage dissociation during the desensitization phase of EMDR. So just as a reminder, desensitization is phase 4 of classic EMDR, where we're having clients pair in their mind that negative cognition, which might be I'm unsafe, along with an image of the worst moment of the memory. So in the event of a canoeing accident, maybe it's the moment that the client saw the canoe flipping onto their head. So they're pairing these two things together, and then we apply bilateral movement or stimulation to help facilitate that desensitization. And we do this in several iterations. So what's the danger here with dissociation? So we know that dissociation is extremely common in PTSD and trauma, especially if it's complex or developmental trauma. And we know that dissociation can majorly derail EMDR, where it no longer is effective and in fact can actually be harmful if a client dissociates too much. Now, of course, that's a danger with any sort of exposure therapy as well, not just EMDR. But because it happens so frequently, we want to be aware of when it's happening or what indications might tell us that it's about to happen, and then we want to know how to best manage it. Okay, so how do you know if dissociation might be occurring? So one overt sign of this would be if you're conducting eye movements and the client's eyes stop and they appear to freeze, so they're no longer tracking. That's probably about the most obvious sign that you're going to get that maybe dissociation has started. Okay, another indication though, this might be a little bit more subtle, would be that they're still tracking your fingers, but when you stop between the iterations, the suds are not going down. So that distress level or that temperature is not decreasing. In fact, it might just continue to increase. And if they start to approach that upper limit, that window of tolerance, then we know that they potentially could be in trouble. So we're looking at their SUD scores to try to figure out what might be going on with them. Another indication of dissociation might be that instead of maintaining a high distress score, they're not able to tell you where they're at. So maybe you pause between iterations and you say, when you pair in your mind that negative cognition with that image of the worst moment of the trauma, what's your distress level now? And they might say, I don't know. And they might even say that they're feeling spacey or that the image has disappeared or they're not really sure what they're thinking. Now keep in mind that it is common for the image and the negative cognition to go in and out during desensitization, and that's not necessarily indicative of dissociation. But if you find that they seem a little bit confused, they can't really identify their SUDs, then that kind of means that they're getting separated from the body, that they're starting to float off. If they're not sure what they're experiencing, these are all indications that this might be happening. So they're not desensitizing quickly, maybe they're not tracking your fingers anymore, and maybe they're not really sure of what they're experiencing. So how do we deal with this? So a main way to deal with this is to, of course, stop desensitization if you even suspect that this might be occurring. So first thing is to stop that process, which is facilitating them going into dissociation. Okay, so stopping, having a conversation with them about what their experiences are, and even just pausing from the traumatic material can help the SUDs automatically come down for a lot of clients. So we want to stop that desensitization. The other thing we want to do is bring in those resources very quickly. So we want to return back to resourcing. So you might return them to secure place. You might have them put that traumatic material back into container. You might have them bring to mind a figure that is safe and loving, nurturing, protective, that kind of resource. And what you're going to want to do when you call in or you pull in those resources is keep track of the SUDs and if the SUDs are going down. Okay, so with a lot of clients, we can do this. We can activate those imaginal resources to help them restabilize. But sometimes the client has gotten too activated, and that's not even helpful. They're completely outside of that window of tolerance, and sometimes this happens faster than we'd like, and we don't even know that it's happened, even in a short iteration. They've completely exited that window of tolerance, and you need to pull them back quickly. In that situation, you may opt to use some grounding techniques. And what I really recommend when the dissociation is strong is to specifically elicit a smell. Okay, so remember, grounding techniques are sensory awareness techniques that engage one or more of the senses. So we can do grounding techniques where we touch things, or we look around and we see things. Maybe you're going to name, 5 things that are purple around you. So these are all examples of grounding techniques, but the more severe the dissociation, the stronger the sensory experience is going to be required to bring the person back to the present moment and back to themselves. So what I recommend doing is using smells. The reason why I like smells is because all sensory information, when it flows into the body, is routed through the thalamus except for what? Smell. You may know that smell routes directly into the amygdala. Okay, so what's the point of me telling you this? Well, sensory information that's first routed through the thalamus, another subcortical area of the brain, when it's routed through the thalamus and then to the amygdala, it gets a little bit watered down. So as a general rule, the more areas of the brain that a signal flows through, the weaker the signal becomes. So when you route information through the thalamus and then to the amygdala, it's a little bit weaker than a signal that can project directly to the amygdala. Smell is the only type of sense that goes directly to the amygdala, which means that smells are the strongest sense that we have. It's unfiltered information. So if you want to disrupt someone who's dissociative as fast and as intensely as possible, have them smell something that's very strong. So I keep in my office some essential oils. Lavender, pine, peppermint are some of my favorites. And what I can do is put it under their nose, have them smell it. And you'll see that it's a little bit jolting. They'll go, woo, woo, and they'll come back to the present moment. And sometimes clients don't like this experience, but it never fails to bring them back to themselves. So if someone's dissociative, consider using smells to bring them back. You can also use more intense tactile stimulation. So you can use, for instance, maybe an ice pack. So I keep in my freezer little iPads that are frozen. You can put those in their hands, and that's another way to quickly bring them back. So just remember, they need a strong sensory experience to come back. So stopping that desensitization is key. Restabilizing them, resourcing them, and then trying to elicit a strong sensory experience are all ideas. If then you're wanting to avoid more dissociation moving forward, one thing you can do is you can be sure to restabilize them, activating those resources, bottom up or top down resources, every single time you do desensitization. So you're re-resourcing them all the time. And you can flank it on both sides to where you do those techniques, then you go through the desensitization process, and then on the other end, you restabilize. So these are some ideas for how to detect dissociation, and then some ideas about what you can actually do about it.